you're just seeing my channel for the first time, you're welcome. My name is Dami, and I talk about health, I talk about lifestyle, I talk about relationship, I talk about motherhood and all those nice things. So in today's video, I recently just resumed back work, and I will be sharing some of the common things that people come to the hospital to complain about. Like every 1 out of 10 patients, we usually have this, and in no particular order. The first thing is hypertension. Hypertension is not just in the youngs, but also in the olds, in the middle age. It ranges from youth to teenagers to adults coming down with hypertension. And the question you want to ask is, why are people coming down with this condition, hypertension? I'll tell you briefly. Lifestyle. A lot of people, especially in this part of the world, they do not really have a very good lifestyle. They grab anything they can see on the road. They are always on the move. There is no time for enough exercise. There's no time for enough rest, and people sit down a lot, or they don't really just have time to take care of their health. Of course, the stress level is also on the high, so a lot of people come down with hypertension. Now, to round this up on hypertension, of course, there are a lot more to talk on hypertension, but to round this up on hypertension is that if you know that you're hypertensive, first and foremost, you need to know that the treatment of hypertension, it's not like a malaria thing that you take your medication and then it goes and then you stop taking it. Hypertension is a lifelong disease that is being managed. So you need to manage it with your medications. Okay? Now, it's not something that you take your medications today and then tomorrow you decide not to take it. These are some of the mistakes most people make. So you take your hypertensive medications today, the next day you don't take it, you wait till the thing is high again and then you take it. It's not going to work. It's not going to balance out, especially when you're not doing any other thing aside this medication. It is also very important for you to know that aside medication, there's a place of what we call lifestyle modification. That is, what are your what are the lifestyle, practices that you're engaging on a day-to-day basis? Do you drink alcohol? Do you smoke cigarettes? Do you take a lot of salt in your food? Do you even have time to exercise during the day? What kind of diet do you have? Do you even have fruits and vegetables? So all these are very, very important, especially reduction in your salt intake. It is absolutely very, very important in managing and controlling your BP. So some people will say, I'm using my medication and then it's not working. That's because you're most likely just using your medications without carrying out these lifestyle changes I just mentioned. Reduction in your salt intake and your seasoning cube, which we popularly call Maggi in this part of the world. You have to reduce the consumption. You also have to cut down on your alcohol or stop it, okay? And also, you also have to work on exercising. Be physically active. If you have to sit down at work, try and move about between 40 minutes to 1 hour after sitting. Be physically active. And then you will see that with you taking your medications, and of course, always comes to your health providers. With you doing all this, you're going to see a significant improvement. The second condition that I see a lot of people come down with in the hospital is diabetes. It's very, very common in this part of the world. A lot of patients come down with this condition. Also ranges from young to middle age and elderly, especially in the elderly and the middle age. It is very rampant for them to have hypertension. This also is diet, and diet again. The kind of lifestyle you also engage in. There's also predisposition from family. Okay, so if you know that you have people in your family, especially your immediate family, your father, your mother, your siblings who are diabetic, you need to take this very seriously by taking cognizance of your health. Another thing a lot of people come down with in this part of the world is peptic ulcer disease. Yes, a lot of people come down with this. They come to the hospital for this reason. Why is it on the high? Well, I would say also that a lot of people abuse some certain kind of drugs. We call them NSAIDs. You know what this drug do eventually is that it cause a kind of erosion, you know, in the digestive organ, and then there is bleed. And of course, there's a bacteria that actually causes this peptic ulcer disease. We call it the Helicobacter pylori. It's like, you know, one of the highest cause in this peptic ulcer disease. But besides having peptic ulcer disease, there are also some common conditions that are related to it, like gastroesophageal reflux diseases, like erosion of your intestine, and reflux itself. So some of the ways of ensuring that you don't belong to this category, or even if you have it, how to now maintain it is by reducing or avoiding smoking, things that could aggravate the ulceration that is already there. Then cutting down on spicy foods, okay, and also the use of NSAID, non-steroidal anti-inflammatory drugs for pain. You have to reduce it drastically. The fourth reason why a lot of people come to the hospital is pain. People complain of back pain, waist pain, head pain, and a lot of other pain. This is also one of the commonest reasons why a lot of people present to the hospital. Some of this is being caused by the kind of lifestyle they live, the kind of job they do, sitting posture, and the way they live things. So when we see patient that comes in, we of course counsel them and we give them medication. The last but not the least, this is not to say that these are the only reasons why people come to the hospital, but this is just based on my observation since I resumed back to work. And the last but not the least is having some kind of viral diseases like HIV, like hepatitis. It is really on the high, and I feel that I have to have a video on hepatitis B proper, because since I got back, I've seen like some couple of patients who has this virus and they do not even have an idea how they got it. But to summarize, for these viral diseases, mostly they are contacted through contaminated, when a patient has it, a patient that is already infected, it's usually contaminated by blood, okay, so usually sexually transmitted, or there is a contaminated surface and then you have a cut on your hand, you can easily contaminate yourself by having it, especially hepatitis B. All right, so these are the common reasons why a lot of people come to the hospitals. However, for hepatitis B and HIV, it is not a death sentence by any means. You come to the hospital, we're going to carry out the necessary investigations, and then we're going to help you. I hope you find this video helpful. If you want to see more videos or content like this, I would like you to like this video, share, comment, and see you in my next.